Hi everyone, Dr. Timothy Gallagher,
Dr. Michael Marciello.
and we're from Maragal Medical. And we're sitting today because poor Dr. Mike has been injured. He sustained a pretty significant injury to his right ankle and his left knee. So today we're going to talk about his road to recovery and the conservative cutting-edge treatment options that are available to him to get him back on track as soon as possible. You're definitely not going to want to miss this one. Okay, what the heck happened?
Well, when you're trying to be active, we always encourage people to be moving. Well, I was a former baseball player. I've been a coach for a baseball team and now an adaptive baseball program that I was in practice and I rolled my ankle. Well, that process didn't go so well. So not only was it a sprained ankle, now this was a 3-level fracture.
It was more than a roll.
So I really did my ankle in requiring surgery.
Yep.
So during this process of actually going through sporting events to stay active, now I've been impaired for 4 weeks. So that's where I am at this stage. I'm in a boot. I've just been allowed to start putting some pressure on my foot in the boot because I've got plate and screws in there on my ankle because it was a significant injury that I needed the surgery. Also, just to make it interesting, because I wanted to go down when I was playing the game, is that I also injured my knee and I have a non-displaceable fracture in my knee. That makes it difficult when you try to walk on the good side, so to speak, when you can't put any weight on the bad side. So it's been a challenge because I'm non-weight bearing, such as in the wheelchair. Just started using crutches, but trying to use that on a knee that's not fully healed as well. But this is what we do for our work.
Yeah.
How many patients do we see come in with multiple issues? Perhaps not traumatic, but realities are arthritic. You may have a combination of back pain problems with knee arthritis or hip arthritis. We see this all the time.
Yep.
So the concept is right, well, how can I get through this? Well, it was a bad injury, it hurt. But we got into surgery really soon. I got my ankle kind of fixed into a cast initially. I had my knee kind of looked at and protected, but we came back to the office, received a regenerative injection into my knee to help the healing process quicker. And within a couple weeks, I was able to put more pressure to that leg, allowing me to walk with my crutches and support me so I can get up out of the crutches, out of the wheelchair and now into the crutches. It no question is a lifesaver to speed up the process, but it's a slow process. I used some medications, took some standard anti-inflammatory medicines for a short bit, and then that Tylenol that I'm using now infrequently because we're trying to do this without pain medicine.
Right.
We need to try to stay active, but my gosh, I'm so tight. This is the way I get up out of the chair. A lot of shoulder work here, and I have to lower myself down because I can't put the pressure on either foot or my knee. So our patients do that all the time. When you have an arthritic knee, they're using their shoulders, they're throwing themselves forward. And trust me, I know what you feel like. That process, fortunately I'm in decent shape to do it, but it takes a lot of effort. And we need to try to look at that because now I have compensating moving patterns as many as you do as well. I'm shifting weight off one leg onto another, but putting extra force onto different muscle groups to protect another joint. My back is stiff because I'm sitting in a chair, and my gosh, my hip flexors are just really tight because I've been sitting for 4 weeks.
Right.
This is why we always recommend to our patients to keep moving.
Yeah.
And we have the options here with our robotics Hanover machine that once I have a little bit more ability to stand on my ankle and get more movement, I can actually get some additional balance training and proprioception, which is called position sense, and get the strength back in the ankle. At the same time, we have ability to use ways in which we use equipment to use the adaptive technology to use for the other joint that's not working as well either.
And as you're compensating too, you're noticing you're recovering from your knee or recovering from your ankle, but all the other areas that are picking up the slack super tight, chiropractically, we're gonna
Right.
certainly wanna get things moving in your back and your upper back and your neck, because just posturally looking at you, and you've been really great this week. You started seeing patients on Monday. I'm not sure how you managed that, but it was pretty impressive. But that kind of runs into what we see with, a lot of the patients that come in, without the traumatic injury, but that's why we kind of look at them from head to toe, because you're constantly compensating.
And that's what we created this service, right?
Yeah.
We created this program to make sure we can cover those different areas, because when you come in and tell me that your back hurts or tell me your shoulder hurts, the traditional medical model is that the doctor's going to address what you complain of.
What you point to.
Exactly. So if this hurts, we're going to address it. But and then, oh, my knee hurts. Well, we'll go see the knee guy. That just misses the boat on relation to how we can take care of you as a person moving through these different channels. Because obviously my knee and my foot hurt for that trauma, but I'm getting tight in these other areas. That's what we do need, the chiropractic adjustments, that we need the motion, we need the additional services of physical therapy, and then some of our injection services to help speed up the process to allow us to get those movements. So trust me, we don't want anyone to go through what I have gone through from a traumatic injury. Two sides, but it doesn't matter if it's traumatic or if it's just chronic wear and tear. It still is impairing, it still is disabling for people, and it really puts a strain on the body physically, mentally, and so we have to really address those things. So this is what we do. We know this space very well. Now we just got to implement it for both myself and for you who come to see us.
Absolutely, and the key to that is you want to look for a team approach and making sure we're looking at you from head to toe, and in the recovery stage, making sure we're using all of the conservative options that we have available to us: the regenerative medicine injections, the chiropractic, the physical therapy, class 4 laser, PRP injections, all of that working together to actually address what the problem is. For more information about our practice, please check us out on the web at maragalmedical.com. Remember folks, we take most insurances and we'd love to see you. I hope you have a great day. We'll see you soon.
Bye now.